Hi, Ms. Benet.
Hi, Dr. Schoenberg. It's really nice to see you.
Likewise. Did you get a chance to review the educational pamphlet on mammography that my assistant gave to you this morning?
Yeah, I brought it with me. It's right here, and I did answer all the questions and read it through.
Great. So it goes over the benefits and risks of getting a mammogram after age 75. Do you now know whether or not you want to continue getting mammograms?
Well, I'm not sure. I'm thinking about it. No one in my family has had breast cancer, so I'm just not sure.
So, as the pamphlet describes, it is not certain that getting a mammogram after age 75 helps older women live longer. At best, we think that about 1 out of 1,000 women age 75 and older who continue to get mammograms will avoid breast cancer death after about 5 to 10 years.
1 out of 1,000?
Yeah, that is the estimate. Meanwhile, there are some downsides to getting mammograms. As the pamphlet mentions, about 100 out of 1,000 women who continue to get mammograms will experience a false alarm.
Oh, what does that mean?
So a false alarm is when a woman undergoes mammography and it is read as suspicious, but additional mammograms and additional tests do not show breast cancer. But meanwhile, most older women find this experience very stressful.
Well, I'm sure I would too.
Yeah, and in addition, there are other downsides. It is thought that mammography may find some tumors and breast cancers that never otherwise would have caused problems or symptoms in an older woman's lifetime. But since we don't know which breast cancers will continue to grow and which will not, nearly all older women are treated for breast cancer.
What do you mean by treatment?
So treatment of breast cancer for older women usually requires surgery and sometimes radiation and sometimes a pill that is taken for 5 years. And most older women do well with surgery, but some do experience side effects from radiation or that pill.
Well, I'm not so sure I would like that. But I would hate to get diagnosed with cancer later and not have done anything about it.
Well, it is true that getting a mammogram may find breast cancer early when it is small and only minor surgery is required. However, then again, some of the breast cancers found may never otherwise have caused problems or symptoms in an older woman's lifetime. So more and more data are suggesting that a woman needs at least 10 years to live to potentially benefit from getting a mammogram.
Well, I don't know if I'm going to live for 10 years.
Well, obviously no one knows how long they will live. Based on what I do know about your health and your answers to the health questionnaire questions, it does look like a mammogram is unlikely to help you live longer. So some women with your health characteristics would still choose to get a mammogram for the small chance of finding aggressive breast cancer early. However, others would not want to increase their chances of undergoing tests or treatments that are unlikely to help them, and these women would choose not to get a mammogram. So this is something you have to think about for yourself and decide.
I do have a couple of questions.
Oh, sure. What are they?
Well, I breastfed my children, and I read somewhere that helps with breast cancer, like not getting it.
So that's true. It is thought that breastfeeding reduces your risk of getting breast cancer. But not much research has shown what it does for late-life breast cancer, and the greatest risk factor for breast cancer after age 75 is actually age itself.
What about radiation? I'm kind of old now, and I've been getting a lot of, different, dentists and mammograms and things. What about the cumulative effect?
I mean, radiation dose does accumulate over time. However, each mammogram is very small and unlikely to increase your risk of other disease. I mean, even if you choose not to get a mammogram, there are other things we can do to improve your health and quality of life. Speaking of which, are you exercising?
Well, not exactly. But why don't we talk about my next appointment, and by that time I will have done a lot of walking.
Perfect.